Welcome to day 6 of the Pearson Center's Change Conference. My name is Andrew Cardozo and I'm president of the Pearson Center and delighted to welcome you to a discussion by a really stimulating panel. As you may know, the Pearson Center is a leading progressive think tank that addresses the key economic and social issues of our times. This conference builds on the last year's work where we addressed COVID and beyond through 40 webinars attended by 8,000 people and issued several papers on issues such as the future of work, seniors care, child care, and reimagining policing. Over these 3 weeks, our Change Conference consists of 12 webinars on issues primarily related to economic rebuilding. Our approach at the Pearson Center is best described this way: we bring people and ideas together. We are proud to say that as a think tank, and as in this conference, we engage with representatives of all 5 federal political parties, top business and labor leaders, like some of the people we have on today, and many other experts in their fields. The focus of the conference is simple. With everything changing so rapidly, how do we plan for the long term? I want to take a moment to recognize that the Pearson Center is headquartered on the traditional lands of the Algonquin and Anishinaabe peoples, and our panel and audience come from across Turtle Island. I also wanted to take a moment to thank our invaluable sponsors. Our platinum sponsor is Bruce Power. Our gold sponsors are CN and the Hill Times. A special thank you to our sustaining sponsors, who are the International Association of Firefighters and Canada's Building Trades Unions, and our long-standing sponsors, AMAPCEO, Ontario's professional employees. While the webinars are free, we welcome the audience to visit our website, thepearsoncenter.ca, if you would like to make a donation to help towards these kind of events. Now to the panel discussion. Today our webinar is entitled The Public Service, COVID and Beyond, Burden or Saviour, with a stellar roster of guests who I will introduce briefly so that we can hear from them. We have invited them to discuss what they have learned in the last year about the particular role of the public service and reflect on their respective contributions to our society of the public and private sectors. The panelists are Debi Daviau, a very effective and influential force on the federal scene. She is president of the Professional Institute of the Public Service. Dave Bulmer is president and CEO of AMAPCEO, Ontario's professional employees, where he successfully promotes the interests of his members and the betterment of the broader society in the province. Scott Marks is assistant to the general president of the International Association of Firefighters, leading his members who come from every province across the country. As the saying goes for his members, firefighters, when we rush out, they rush in. Senator Peter Boehm, he's a member of the Independent Senators Group and a former senior official. He has been a deputy minister in various departments in the government of Canada. Now, they've all been on the Pearson podium before, so welcome, a sincere welcome back to all of you. I'm delighted to tell you that our moderator is Kathleen Monk, principal at Ernst Smith Strategy Group, a regular media commentator and former and founding executive director of the Broadbent Institute, one of our colleague think tanks, who I will add has always been very encouraging of the work we at Pearson do. So it's a special treat to have her at the Pearson podium and on this topic. So the format briefly is as follows. Following a discussion of about 45 minutes, we will take questions from you, the audience. So please send in your questions on the question box, not the chat box, the question box, and we will get to as many questions as we can. We will try to end around 1 p.m. Eastern time. So with that, over to you, Kathleen.
Thanks so much, Andrew, and thanks everyone for joining us in our homes, as we all are under lockdown. It is a pleasure to be a part of this Pearson Center event today, and great honor to participate in a panel that really focuses on COVID, the pandemic, and the public service, and the extraordinary work that we've seen since this COVID pandemic has started, from just how remarkably it's changed. The pandemic, we know, has required a level of federal intervention and spending that we haven't seen since the Second World War. It's been an extraordinary time as an observer of public policy and politics, and also an observer of the public service. Really once in a century event, politics changed overnight. Policy has evolved over lightning speed, and we've seen the public service having to implement all of that new policy at such a rapid pace. So I'd like to open up the discussion really and asking first Debi really for your observations of the role of the public service during the pandemic, how they have not only delivered on the promises and the policies, but how they have met the expectations of the public.
Well, certainly the public service has never been immune from the public's, concerns over how hard we work and what we do for them. But the pandemic really did highlight some extremely critical work that public servants are involved in. My members in particular were involved in bringing in the CERB or the CURB, whatever acronym we're using for it, and the other benefits packages. Those were applications developed in a matter of weeks in order to get money into Canadians' hands. They were involved in securing personal protective equipment, in a lot of COVID science, from the work being done at the Winnipeg Microbiology Lab on COVID therapeutics and vaccines. And even, the reusing of personal protective equipment, all really important work. We had scientists and researchers working in labs that had been converted to produce hand sanitizer and other important COVID items. We also were involved in repatriating Canadians from all around the world when the pandemic first struck. And very importantly, we represented the IT workers who put in place all of these all the mechanisms for the rest of the public service to be able to work from home, whether that was increasing the architecture and infrastructure to making sure people had the equipment that they needed. And that's, and nurses working in northern communities, in other frontline areas like Correctional Services Canada. And so our members have been extremely busy delivering on crucial services to Canadians during the pandemic. And our members were actually involved in the approval of the vaccines, and so with vaccine hesitancy out there, hopefully they'll also be involved in making Canadians feel secure about that vaccine. And so, I really can't, obviously I could go on and on and on, but the amount of work taken on by the public service, who basically turned on a dime, took their work home wherever possible, and continued to deliver on these critical services. And I think Canadians must realize at this point that those were critical services, and thank goodness we had a fairly strong public service in place to take on this challenge.
Dave, some of your members are directly in the eye of the storm. Debi's outlined kind of some of the roles that her members have played. I'm keen for you to do the same, but also to touch on that question of do you feel that the public has seen the public service as responding and meeting the expectations during this crisis?
Thanks, Kathleen. And as happenstance would have it, I have some ambient noise here, so I'll try to be brief and apologize in advance. I think public servants have played a critical role in keeping the public safe and ensuring government services continue. I like to think that we've brought some calm to what has been the chaos of the last 13 or 14 months. And I think people actually realize that. To be envious is to be human, and there are people who are unfortunately unemployed who on occasion, I'm sure, envy the fact that our members are working. But I have to make people aware, though, that they're working in less than conditions. We have a few hundred people who are working directly in the labs, coming in contact with contagions, on a daily basis. We have the other 98% of our members working remotely. They're not only working long days, they're parenting, they're cyber tutoring, they're overloaded, and yet they carry on. And I think they've they've proven their value. It's important that we realize that the job that public servants do is independent of the politics of the day. And they were really, when we're talking about tens of thousands, millions of public servants across this country, we're literally the backbone of society, the economy, our local communities. And I honestly believe that public servants have overachieved, whether it's in the physical workplace or working remotely, by maintaining the promise of public services to all of our citizens. And I hope that the general public sees it the same as I do, obviously.
And you know, I think they do, Dave, because I did see some polls on the subject, and the popularity of the public service has certainly improved over the course of the pandemic. I think Canadians really are seeing the evidence of the important work they're doing.
I agree. I've seen some of those polls too, and certainly firefighters have always benefited from great polls and their reputation. Before I get to that, Scott, and ask you some questions about the difficulty that firefighters face being frontline workers in the middle of a pandemic, I just want to take a pause and actually back up and ask Senator Boehm for a minute, Peter, as you've given me permission to call you. Peter, if you could speak to just your observations. You've had such a long career, both in diplomatic service and also in the public service, now as a senator. Have you seen in your lifetime policy evolve at the speed and the rate that we've seen in this past year, and just the level of intervention? And do you have any broader comments on what it's taken for the public service to even mobilize to implement?
I've never seen anything like it over such a sustained period of time. And I think, hats off to public servants, whether they're federal or provincial or municipal, frontline or behind the scenes. It's not just execution. It's when governments come to you and say, hey, we need some ideas because we don't really know what to do. And you're the pros. So give us the ideas. And so just to mention a few departments at the federal level who really stepped up. Debi mentioned the CERB and the various programs, but a lot of that was coming out of ESDC, was coming out of finance, the execution through CRA. We like to mock CRA, especially this time of the year when we're paying our taxes, but that was the vehicle. And to have money going into Canadians' accounts within a week of programs being announced, it's unheard of. It wouldn't have happened in any other country that I know, at least in the G7. So that policy ideas and formulation phase is very important. And sure, some things go sideways. They're not the best ideas. That always happens, but it is providing that fearless advice. And I should also add, the deputies and the senior management were working really 24/7, sometimes at great risk to themselves, like everyone else. So the fact that everyone pulled together, and I say this as someone who used to make the sausage in departments as an official. Now I'm in a position, I sit on the National Finance Committee of the Senate to actually see the final product, and the final product is pretty good, all things considered.
Thanks for that. So Scott, let's pivot back to that in terms of your members and the broader, you can probably speak to this because of your experience in the labor movement, but the broader frontline workers, whether they be emergency or even our teachers, our nurses, our healthcare professionals, the broader frontline, how have they been managing during this time? Because, it's not like they can stop responding in the middle of a pandemic. So what are the issues that your members are facing?
Well, you're exactly right. And I mean, firefighters, paramedics, police officers, they can't work remotely.
Yeah.
Idea, but you're going to go to work. You're going to go on emergency calls. Those are always unscripted and in uncontrolled environments. It's not a new situation for us, and certainly we've been through SARS and we were through H1N1 and we learned a little bit about it, and certainly the procurement of N95s and all the personal protective equipment that go along with it. I mean, some of the experience that was gained through some of those past experiences has been extremely helpful. But I think the prevailing thing here is, and I want to recognize, the broader public sector, as Debi and David mentioned. I mean, the pivot was amazing, and how quickly services were rolled out in this country was truly amazing. Our members, as with others, were faced with, at the beginning, I think there was just a lot of concern over it. So there was so little known about the virus. We were sent to work. We had, you're not in a position, firefighting is very labor intensive. You just, if you're extricating people from an automobile, you don't have the ability to deal with social distancing. So, and then you're going home to your families and having the impact of that. So I mean, a lot of the initial concern, I think, is worn off as we've learned more about the virus, but those are the kinds of issues. There's the actual, what is taking place, and then how that plays out in the person's mind when they're going home to their families and everyone else. So it's been a very difficult time. But certainly, as everyone has recognized, our members responded, paramedics have responded, police have responded. Of course, the other main concern that we share with so many other people is trying to make your family life work with that when you've got kids learning from home. And I mean, and you do touch on the other frontline workers. Like every day, we're going into the grocery stores and we're seeing those people. At least our members have had the ability to have sick time available to them, and those types of benefits, which I think now has finally broken through the public consciousness on why these things are so important, because it protects the health of everyone in the end. It's been tough, but our people, as the rest of the public sector, have responded, I think, very well.
I think that's a great segue, because while firefighters, police, emergency responders of all sorts we've always understood the risk that they took in their day-to-day jobs, and hence why not only emergency responders but nurses and the healthcare sector has always held such high respect in the minds of Canadians and the broader public. But this pandemic has brought to light how we see risks in other professions, like you just mentioned, Scott. The grocery worker, the public transit officer, and it's also brought to light the very nature of how the precarity of work for so many people, particularly racialized people of color and women in our society, those lower wage workers who don't always have access to whether it is paid sick days or a decent wage. And so I'm wondering, David, if you could speak to how the labor movement overall has responded to this crisis. Obviously, the labor movement has always worked strongly on the issues of the fight for 15 and benefits for workers, but how has this galvanized not only the labor movement, but I would say the broader public, and how do we get them, what has to change in the near future?
Yeah, I think we need to come to some acknowledgements and some basic things, like frontline workers are not emergency service workers with special training, special equipment, and paid sick leave, as Scott mentioned. And God bless all those people for the endurance that they're showing. But with respect to wages, there's always going to be a disparity in the value that we place on various types of work. That's obvious. But when we're in a pandemic, I think we need to realize that the work that many low-income workers perform is essential, and that we must pay them at least accordingly during that time frame. And I'm not talking about $2 an hour at the good graces of Galen Weston and company. I'm talking about a 50% increase in your salary because of the danger that you're in. But no one thing will improve workers' futures more than paid sick leave and being afforded what I call the human dignity to not have to go to work while you're ill. And to not be afraid of losing your income or your job security, or worrying about infecting your coworkers or bringing infection home. Paid sick leave would be life-changing for many, many people, and not just during a pandemic. And so I think it's inherent on those of us of privilege who have sick leave, those of us who are unionized, where it's commonplace, that we demand that everybody else get it. We need greater access to unionization and the accountability that it brings to workplaces. Safety and productivity are not at odds with one another, nor are decent wages and profitability at odds with one another. It's been shown that they all work well together. We need to get over that fear. And so I think we owe it to our social safety net, I think we owe to unions what our social safety net has become over the last 40 or 50 years. Most of those things have been fought successfully within workplaces before they became the norm for greater society. So we should be making it actually easier for people to join unions and not harder. And that's a whole other topic. But I think sick leave is an absolute must. As Scott mentioned, we need to have greater access to unions if we want to bring up the lowest common denominator.
Comments on that, Debbie, and also I'd like to hear from Peter, if possible, on what the political hesitancy is. We've seen extraordinary, just over the last, I think, 4 or 5 days, the push and possibly the flip with Ford's government. But first, Debbie, comments on that, on how the labor movement has responded and what else needs to be done?
Well, public or private, I think there's this great recognition that we need to be taking better care of these communities that are more impacted. And, for our members who are doing very well in terms of those terms and conditions during the pandemic, there's still outlying issues around flexibility and work-life balance for primary caregivers, and, recognition and respect. But if you zone right in on that community, those frontline workers who, racialized communities, less fortunate communities who are more at risk, I mean, yes, paid sick leave days, that's definitely at the top of the list, adequate personal protective equipment, making sure they are vaccination priorities. I mean, there's several provinces that have not given due consideration to those who are in the most at-risk work at the moment. And, even at the federal level, we've identified certain priority immunizations, and yet it's the provinces that will determine whether or not those people can somehow access priority immunizations. So we actually had nurses working in northern and remote communities, Indigenous communities, who couldn't get vaccinated, say, in British Columbia or in Ontario. So, we absolutely need to make sure that that these people are taken care of, adequately taken care of, and lastly, as Dave mentioned, risk pay for sure.
Peter, can you speak to this?
Thank you. I was going to add that the front line is also global. And when I mentioned departments before, I didn't mention Global Affairs Canada, where there are thousands of people abroad on the front line bringing back Canadians. A lot was done last year. It was the largest mobilization ever, short of wartime, in terms of moving people around and back. I think as we go forward, and I have a lot of respect for the bargaining units, for the unions, the big sleeping giant or iceberg, whatever you want to call it here, is mental health. And employee assistance programs in departments and agencies will not be up to the task. So I think that has to be an intrinsic part of the conversation that the bargaining units have at the federal level with Treasury Board as they look ahead. Paid sick leave for me has always been so obvious. It just begs credulity to see how long it has taken in Ontario. I'm an Ontario senator, and I've been advocating for this for some time. I think the government of Ontario will come to this probably more quickly, because they're looking at declining support, the Premier in particular. But it also makes a lot of sense. The other one that's out there is for the workers who are personal service workers in long-term care and in seniors' homes. That's been sort of swept underneath the carpet after the first wave, and we saw the deaths. But these people are exposed. They do not have paid sick leave. The conditions are awful, and they think, okay, I'm going to do this for a while, but then I'm going to work at McDonald's because it's basically the same pay, and I feel safer. So these are important issues that I think have to be addressed as we move forward.
We are seeing that extraordinary spending that's happening in the government. I guess the question that's on many of our minds is, after this recession, do we expect to or do we anticipate cuts to the public service? We saw after the 2008 recession, we saw an ending of those workforce supports, stimulus, cuts to the public service, and announced in 2010. The Treasury Board showed eventually there was something like almost 24,000 positions that have been cut from the core public service and agency since 2011. I remember the PBO at the time, the Parliamentary Budget Officer, had to fight to even get some of the data and the numbers about that. Do you think that there are going to be those cuts at the public service as a result of this pandemic, or do you think that the pandemic has shown the value of the public service and changed that dynamic? I guess I'll start again with Dave and then go to Debbie, and then specifically want to drill down on the municipal level with Scott.
Yeah, thank you, Kathleen, and obviously I'll focus provincially with Ontario. I think future governments are going to need to address the cost of post-pandemic recovery. Thankfully, it seems that most realize that, at least at the moment, based on the most recent budget here in Ontario, that they're not going to be austere immediately, and that they need to let the health and economic recovery occur. I get tired of hearing the following words, but Ontario, with 40% of Canada's population, spends less on public services per capita than any other province. By far, the FAO's numbers demonstrate that we are operating with 10,000 fewer public servants per capita than the second thriftiest province in Canada. So we are like threadbare already. It's important that the governments realize that public servants' contributions, I think, go beyond the work that they perform, and that their salaries, as I mentioned earlier, are actually the stable income that permits small business and other enterprise to exist in many of communities across Ontario and across Canada. And at AMAPCEO, we obviously appreciate that the government, who is our employer in most instances, although I have other bargaining units, has obviously extended itself and had to because of the pandemic. But we've taken the opportunity to offer them our abilities in finding efficiencies. To Peter's comment earlier about knowing how the sausage is made, we're literally amidst all of that, so we can point out those sorts of things. But one of the things that we've been really emphasizing is what we're referring to as the workplace of the future. And the workplace of the future isn't necessarily artificial intelligence, which is what we might have all said 14, 15, 16 months ago. What it is the ability to work remotely for those who can work remotely. And we've shown that that's been very successful. And so having flexibility as a government, and so now when I talk maybe about civil servants as opposed to public servants as a whole, allowing them the flexibility to work from home, to work from a satellite location that doesn't require them to drive into a large urban area or overtax infrastructure and transit and harm the environment and so on, is good for work-life balance, but it also provides inherent cost-saving capabilities with things like real estate and rent and overhead, and all. There are things that we can actually do to recoup some of the expenses that we're incurring right now, and we encourage the employer or the government to actually invest in public services and treat them as a necessity and not as an expense.
Debbie, sorry, do you have any comments on that? And then I'll go to Scott.
Well, thankfully I can, we saw in the budget that there really was no sign of austerity in the public sector in this budget anyways. But that doesn't mean we'll be resting on our laurels and waiting for that to come down the pipe. We know that the public service makes an easy target for governments looking to save money. But we also know that, as we already spoke about, Canadians have seen the evidence of a strong public service. So, we have been advocating over the past several months to make sure that the investments are made where they need to be made. And I think there are ways to get more money into the coffers, and one of those ways that we didn't see enough of in the budget is through tax fairness and making sure that everybody's paying their fair share, and funding those critical programs, that funding the money that needs to go out. And we don't call it the workplace of the future, we call it the future of work, but same concept. Consideration to hybrid work environments, saving on government workspace. That will also help on the mental health front, I think, giving people options about how or where they work anyway. But I do believe that austerity is always a concern for the public service, and certainly when the country is in such big debt, we can't simply sit back and hope that this government or the next one doesn't take a pop at the public service.
Scott, the situation's really different at the municipal level that aren't able to carry by legislation, are able to carry, and there's concerns that there actually will have to be cuts at the municipal level just because of the funding crunch that they're under, or what they've suffered under the course of the pandemic and the lack of resources. What are you expecting there in terms of the impact on frontline services?
Well, we fully expect that, and certainly we, along with a lot of the other people, have been calling for the federal government to recognize the needs of the municipalities through this. Interestingly enough, Mayor Nenshi announced that Calgary has a $98 million surplus from last year. So I mean, it's interesting, and a lot of that was based on the transfer payments they received. But I agree, so much of the discussion around this always is central on cost. And what we know is that firefighting, emergency services, public services are an investment, not a cost. And they need to be viewed through that lens. Many of the studies we've done have shown that proper fire protection actually saves money in the long run for municipalities. It lowers insurance costs. It also, we used to make the big mistake in our business, and you still hear it all the time. You'll have a major fire in downtown Toronto, and they'll talk about the property loss. $3 million of property loss, this block went out, or whatever. No one ever discusses the savings on having, because there was a proper response, because they were able to put a stop on the fire and hold it to 2 structures. What was the savings of that? Without a properly equipped fire department, without proper response times and proper staffing, you don't do that. You lose more structures. And that's always lost in that conversation. We need to, and certainly the issue around balance sheets. I mean, the City of Toronto, where I worked, where I come from, I mean, it's just been the age-old discussion of, it has not been a problem of spending, it has been a problem of revenue. Even John Tory recognized that when he went through his little sabbatical before he ran for mayor, and he was actually talking honestly at the Chamber of Commerce, and made that declaration was Toronto's problem was a revenue problem, not a problem of spending too much on services. Municipalities have got to come to that recognition. As Debbie said, we need a proper equalization of revenues. And what the pandemic has shown more than anything is that certain industries and certain businesses have done very well. And there has to be a consideration in how we look at that. And again, as we saw that same debate as well with the $15 an hour issue. We saw, the threat that fast food restaurants would switch to robotic waitresses or waiting. And the bottom line is there has to be a discussion on how you start to tax those types of items. And what, the rollout the benefit for that should be in supplying better services for an aging population, for the situation we have across this country. It shouldn't be just filling federal coffers or businesses. It should be to roll out services that the people in this country need. But you have to look at the revenue side of the budget sheet.
Yeah. Excellent segue again. It's like you're setting up every question for me, Scott. I'm very grateful for that because we're getting some great questions in from the audience, and we're really fortunate to have Senator Boehm on this panel, who sits, as he says, on the Senate Finance Committee. So I'm hoping to turn to you for this question. You know, we're seeing a really interesting discussion erupt, you know, really spearheaded by Janet Yellen, and other G7 governments are finally starting to look at tax fairness issues, the corporate tax minimum. You've seen that discussion in the news in the last few weeks. But there's been a resistance of the current government to look at new revenue sources, or broad new revenue sources, I would say, things like a wealth tax, things like a pandemic surtax. Senator, could you, where is the resistance coming from to look at those revenue sources? And if there is an embracement of new robust public policies like childcare, universal childcare, or review of our long-term care situation, doesn't the government isn't it incumbent upon them to look at new revenue sources?
Well, yes. I have not finished reading the entire budget. It's a bit of a brick. I think everybody knows that. But there's a big D question out there, and that is debt. And it's real debt and it's perceived debt. So at the last economic recession, 2008, 2009, I just arrived on my assignment as ambassador to Germany. The Germans put in a law that they called a debt break. They've since gotten rid of it because it doesn't work. And the idea of actually paying off your debt is an illusory idea. And it is reflective of the thoughts of Thatcher and Reagan in the past. But everyone now is a Keynesian. I know it has been said by others as well. So spending when interest rates are low is the way to go. And in the absence of any really strongly identified fiscal anchor in the budget, you have that conviction that the recovery is going to allow for more spending as opposed to raising taxes. Now, on beneficial ownership and the like, there's something in the budget. So tax evasion, tax avoidance, that's a very positive step, I think. But as we move forward, the government, and I think what the government will do, any government will do, whether it's the current government or a future government of another party, will look very carefully at the recovery, at the interest rates, at the monetary policy that the Bank of Canada is implementing, and probably those spreadsheets are going to shrink a little bit as the recovery increases in its pace, before taking any decisions about public service cuts. In my experience, in the 90s, I wasn't quite that senior then, but the Chrétien government introduced program review, which was to respond to a tremendous deficit situation that the government had. And where else do you aim if you don't want to raise taxes, but to the public service? Basically, it didn't work that well. So too, the deficit reduction action plan of the Harper government, toughest thing I ever did in my career, bar none. I've done a lot of tough things. Was in Berlin one afternoon to tell 24 people that they didn't have jobs anymore. Most of them were locally engaged staff, but nonetheless employees of the government of Canada. And that approach didn't work that well either, because the actual overall size of the public service grew. So you can look at natural attrition and other issues, but these proposals where you say, okay, we're going to cut so much, let's leave it to the deputy ministers to decide what the priorities are. The priorities will not be decided, and then someone will say, all right, well, if that's the case, we're going to put a 10% cut on everything, and you will sweep aside services that are very essential. So,
like pandemic response services, for example.
For example. So I think what will happen, the government will very carefully watch the recovery, and ironically, so much of our recovery is going to be tied to the U.S. recovery. And in the U.S. case, the stimulus package there, 1.9 trillion is the size of our economy. That's the size of Biden's package. So we will be beneficiaries of that, and this may promote more growth. But as well, and I think the federal budget shows this, and we'll be studying it in the Finance Committee too, and there'll be a lot of politics associated with this. But investing in new technologies, new approaches, including jobs of the future, the workforce of the future, and the changing dynamic there is going to be very, very important if we want to keep our competitive edge.
Thanks for that. Lots of great questions coming in, so I want to get to them rapid quickly. Debbie, a commenter says, you know, it's that it really is a once in a generation situation, as we've mentioned, and how do we remind and almost set into the public's mind all the work that the public servants have done? Are there campaigns or communications more broadly planned? And if you could speak to that communication of reinstilling you know, the respect for the public service, but also will we see a broader change and less outsourcing going forward and contracting out of services, because we've seen how the public service has stepped up to the plate so greatly in the last year?
Yeah, I mean, there's a lot in there, but we will definitely be, and we have been, and will continue to step up our campaign to recognize the critical nature of the work that our members are doing on behalf of Canadians, and that became easier to do as a result of the pandemic. It was really more in Canadians' faces, and so we will definitely be capitalizing on that. We ran an ad last year and maybe running other advertisements, but you know, those are great. They make our members feel good and sometimes have a positive impact with our reputation with Canadians. But really, it's the decision makers that need to be engaged in order to ensure that that public services continue to be recognized, properly funded, properly resourced to be able to deliver on the work that government is passing on to them. And as for outsourcing, I mean, what we saw in the lead up to the pandemic was a whole bunch of contracted out big projects, you know, culminating in the Phoenix disaster. But before that, we had, you know, email amalgamation and website, email transformation and website amalgamation, also completely contracted out, failed projects. And by contrast, now we have things like the CERB, which was stood up in 9 weeks from the moment the government announced that there would be a program coming. And you know, we were able to do that because our members were, you know, the shackles were taken off and our members were able to just do the work that they do best. And so that relied upon, and I think Senator also referred to that, it really relied upon people at all levels throughout the organization understanding the urgency of the work that needs to be done and sort of breaking down some of the red tape and bureaucracy that allows work like that to continue. So I hope that there'll be like lessons learned coming out of this. Certainly some of the new applications that are being developed where we have a seat at the table and we're advocating fiercely that these, you know, get developed and maintained by our membership because, you know, the proof is in the pudding.
Dave,
we certainly have seen that these in-house systems can be very successful, and we've seen that these full-sale contracted out systems can be absolutely disastrous in terms of money and result. So I think the pandemic certainly has shone a light on the capacity of the public service, and we'll continue to advocate and sort of amplify that message with Canadians and decision makers.
Thanks, Debbie. Dave, on the future of work generally, how do you manage the expectation now that public servants logged in from home, from our living rooms, how they are not expected to work 24/7? You know, one thing the pandemic has said that, you know, many people have said that it's obliterated the last line, if there even was one, between work and home. And I imagine in this crisis setting, even more so for public servants.
Yeah, absolutely. Some of us have stopped referring to it as working from home and more living at work. In that,
good point. Good point.
You know, often I find myself at this desk at 7 or 8 o'clock at night because I don't have to fight the traffic to get home, and you know, make sure that I've given myself lots of time to do those sorts of things. But I think what we've learned is that our members want some form of balance. Probably at the start, they would have loved to have worked 5 days a week at home, and now they might be tilting the other way, and that something in between is what we need to land on. and achieve that balance. We've had great success despite the greatest challenges. So when you think about working from home, you never thought of it in the context that you were going to be teaching your children at the same time, and that you would be fighting over the laptop, just who was going to do that. So I think having success in what was an overloaded activity has proven that it will be successful. And I think back to my earlier point, I think there's a sweet spot between employees and employer when it comes to the civil service and when it comes to the future of work or the future workplace, and that we can strike a balance that may be more economical on the employer side and might be more flexible and more quality of life driven on the employee side.
I don't know if you can answer this question, Senator Beam, from the perspective of construction of policy, but there's a question that came in around, financial supports for business. So the CEBA, I'm going to use the alphabet soup here of different programs that have been created. So whether it's the CEBA or the HASCAP or LEAF or others, all those financial supports directly for business have been commensurate with loss. Right? So businesses have had to prove the loss and the impact. There's a question from one of our viewers around why financial support for workers has been decoupled from income in some ways, i.e. a part-time worker and a full-time worker have the same CERB benefit. Was that necessary because of speed and implementation, or maybe you could comment on that briefly?
I can't comment much on it because I don't know the rationale behind the decision, but I know that many workers did not qualify for CERB. And let me provide you with an example. I met recently with the new Federation of Independent Travel Agents of Canada. It's about 90% women, so there's a gender issue. Most work from their homes. They work on the basis of commission, which is commission delayed, and any bailout of the airline industry should offer something to them. But when it's delayed, it's like 6 months. So they're in a very precarious position, and there are others like that who somehow fell between the cracks. Now that lends credence to the arguments for a GLI, a guaranteed livable income, or basic income, as some say, and I know that's being looked at. But what EI reform should be doing as well is to catch these people who are falling between the cracks. I suspect that the separation may be because there's a graduated scale. There are some people who will be getting into their work environments more quickly than others will, depending on recovery. Tourism is going to be slow, and there's going to be pressure on domestic tourism as well. That's a whole other subject. I wanted to just, while I have the floor, come back to something that Debbie said about decision makers having to really show what is going on. There is, I think, risk aversion in the public service had increased before the pandemic. Now, post-pandemic, I'm not so sure by risk aversion, what I mean is you will not see deputy ministers on Twitter tweeting anything other than what may be happening and being very, very neutral. The political side will extol the virtues of their departments when things are going well, but they will take the credit, and that's politics as it normally is. And within the bubble of the various professional associations, at least here in Ottawa, people will talk about what they're doing and be self-congratulatory or what. But the average Canadian citizen, coast to coast to coast, doesn't know what the public service is doing. So I think it behooves all of us to really get that message out. I think we have, at all levels in our country, the best public service in the world. I've seen other public services in my travels. We can stand apart, and I think for our own, and that's a message we have to somehow figure out how to get out, because in social media there are a lot of deniers out there, and we all know that.
There was a study a few years back in the UK that actually showed that Canada did have the best public service in the world. We jumped all over it for at least a little while, but we need a new study, it seems.
Yeah. Scott, I'd just like to turn to you for a second. We know that the vaccinations are ramping up across the country. We've seen an unexpected but welcome flurry of Gen Xers rushing out to get their vaccines in the last 24 to 48 hours. Like someone quoted on Twitter, it was like a rush to claim a Cabbage Patch Kid in the mid 80s. They were so desperate to get those vaccines. Can you talk a little bit about your members and what they're facing? Because not all have been vaccinated, and yet they're still required to do that really intimate work that you spoke about, that rescue work that doesn't have the ability to have that 2-meter distance.
Yeah, we've had mixed success across the country. Ontario was actually pretty good and pretty far ahead. We had in February, I believe it was, we had a bit of a problem in Mississauga with, they had about 25% of their firefighters required to stay home and isolate due to exposures. And the Minister of Health jumped in and immediately got them vaccinated in Mississauga, get them over that. And then it increased the awareness and they were able to take it further. Alberta has been very problematic. They have vaccinated Alberta is one of the few provinces in Canada that have a very strong contingent of cross-trained firefighter paramedics in Lethbridge, Fort Mac, Red Deer, a number of the cities there. The firefighters actually are fully paramedic trained and run the ambulance service. So they have been vaccinated in Alberta, and yet the firefighters they work alongside of in the fire stations aren't vaccinated. Premier Carney had made some comments about 25-year-old firefighters not needing the vaccine, not realizing apparently that we're not all 25 anymore. But BC has also struggled with that a little bit. And I know that the BC firefighters have appealed to the government there. And part of it's been, the slow rollout and availability of the vaccines. So, I mean, it's all been part and parcel, but so it's really been province to province where those struggles have been faced. We're getting there, but probably not as quick as we would have liked to have seen. We experienced this in H1N1. We had the same problem with pandemic sequencing that was laid out because part of the problem has been that in a lot of cases they didn't realize firefighters are as actively involved in delivery of emergency medical services as we are as well. So that's one of the problems as well.
So the feds, like Public Health Agency of Canada, is setting these like general guidelines around vaccination priorities, but the authority falls to the provinces. And so it really depends on, unfortunately, politics ends up playing a role in determining who the vaccination priorities will be. Oops, you're muted, Kathleen.
That had to happen at least once during the panel. Sorry, I do have children working from home like all of us, so they make noise. I know we spoke before the panel, and you both Dave and Debbie, you both mentioned there's been outbreaks also at your work, like Scott had just mentioned too. But I want to pivot quickly as we move towards the close of this panel. I want to get a question to Dave just around what happens, and then I'll move to the federal budget, and I hopefully we'll get comment from all four of you. But to Dave specifically, when we see the kind of unpopularity of a provincial government we're seeing right now, and with the Ford government in Ontario, and the dramatic kind of turn that's happened over the last weeks, days, even more so, does that reflect on the public service? How does the public service manage that? Are they also viewed with the same lens?
I think the unfortunate answer is yes, and I think that's always been the case. Whether I don't think we get as much popular rise when there is a popularity increase with the government of the day, but I think all too often we wear the unpopularity of the government. We also, something we've touched on but not gotten completely into today, is we wear the unpopularity of privatization and consultants who do shoddy work and who do it at great expense. And I wanted to touch on a couple of, because I think Scott mentioned this or alluded to this, in that we haven't necessarily learned who we should inoculate first. We also need to take away from the pandemic some lessons. You know, perhaps it wasn't a great idea not to have domestic capability for vaccine creation. You know, maybe we shouldn't have allowed long-term care to become for-profit. So when you asked earlier about what are the messages we need to get out, I think the messages we need to get out are history comes back to haunt us every once in a while. And so if we don't realize the mistakes of yesterday today and then repeat them by you know, making austere cuts and so on, then you're down just to repeat yourself and somebody's going to pay for it down the road. But I guess back to your question more specifically, we as civil servants, I'm sure Debbie and the senator would say the same thing. We are independent of the government of the day. When it comes down to it, we serve whoever the government is. We've all served every stripe of and color of government, and we provide them with the expertise. They make the decisions, and we loyally carry it out. And that's the relationship that we have. And as long as we continue to maintain our integrity and speak truth to power, then I think we've honored our commitment to the public.
Going back to what Dave started with, although we do wear the unpopular decisions of government and directions of government, we don't generally get to enjoy the popular ones.
Mm-hmm. Hopeful that outsourcing question is as a result of the pandemic, the government sees the need to bring more of that work back in going forward. I'll just a few 4 minutes left really, and I'll turn it over to Andrew after that. But Senator Boehm, can you speak to the budget? Extraordinary. I know you haven't read the whole thing, nor have I, from cover to cover. It's 800 pages or close to 800 pages, as you note. But we saw historic investments, a return to more of an activist government, it seems, with massive investments in childcare and workplace supports, lots of stimulus. What does this mean, you know, because of the political timeline that we're in and the mandate of this government, it being a minority? Do you think it will get implemented? What opportunities or challenges do you think this budget presents?
Well, first of all, not everything in any budget gets implemented, and a certain amount is signaling, it's political signaling, but it's also aspirational signaling going forward. I found the most interesting bit was the universal childcare element in this, because it's gone further than any other comment. Usually there were comments or aspirations. This is actually much more concrete, and I know most commentators have focused on that. Secondly, and as I mentioned before, a lot of this is about fiscal anchors, either perceived or not perceived. Some call them guardrails as well. So whether it's anchored in our debt to GDP ratio, where it was before in the last budget, Mr. Morneau had pushed that, or whether it's something new, we'll have to see. And as long as interest rates remain low, as long as there is relative stability in markets, it's a good time to spend. And we're not alone in doing that. And when the leaders get together, the G7 leaders at Cornwall in June, they'll be reflecting on the state of the global economy and what they can do to increase liquidity, and to do that with the IMF as well. So looking ahead, those are important elements. Now, it is a minority government, which theoretically means the government could fall on this budget. I don't think it will. If you look at the polls, it would be a conclusion to draw that it will not fall on this. But if we're looking at an election in the fall, that will be an opportunity to see how the recovery is going, how the vaccination plan has rolled out, and how much of this budget could then be used on the hustings in the campaign by all parties to justify either moving forward or putting the brakes on.
Yeah, the key is to start spending that money before an election, because once there's a certain amount of money invested, it starts to get it over the hump in terms of the ability to continue beyond a particular government. So
absolutely.
Well, thank you very much, all of you, for your time. It's been a great discussion. I'm going to turn it over to Andrew for further thanks.
I am unmuted. You can hear me, right?
Yes, we can.
Great. I just didn't want you to say I'm on mute. Thank you very much, Kathleen. That was wonderfully moderated. A great discussion. You really went into a lot of depth, and I got to say more depth than we really thought you could get to in an hour. So thank you so much for discussing the issues of the public service in this period of COVID and beyond, and also talking at some length about the future of work, the workplace of the future, and the great rebalancing that we have the opportunity of doing about who leads our society and how we run our society. Very much appreciated. So thank you, Debi Daviau, Dave Bulmer, Scott Marks, Senator Peter Boehm, and Kathleen Monk. Really appreciate the time that you've done. For those of you who've come back, thank you for joining us. And Kathleen, your first time at Pearson, I hope you join us again. Really appreciate that. I just want to quickly tell the audience about the events coming up in the next few days. This evening, we have 2 fireside chats at 7 p.m. with CLC President Hassan Yousaf, who is ending his term very shortly. And at 7:30, we have a fireside chat with Annamie Paul, who's just begun her role as a leader of the Green Party. Thursday, tomorrow, we have a session on the federal budget that we've talked about quite a bit today with Associate Finance Minister Mona Fortier. And on Friday at 3 p.m., we'll be talking about Canadian culture with Canadian Heritage Minister Stephen Guilbeault. So thanks all of you very much. Now, the thing is, you can't hear everybody in terms of how much they appreciate all of you. So I'm going to ask you to applaud for each other as we leave. Thanks so much, everybody.
Okay.
Bravo. Bravo to my colleagues.